Tuelekee katika kaunti ya Nakuru ambapo tunaye mwanahabari wetu Ivan Sasiba hivi sasa anajumuika pamoja na baadhi ya maafisa wa chama cha wauguzi humu nchini wakiongozwa na Seth Panyako. Wana masuala ambao wanataka kuyazungumzia huko, ikiwemo pamoja na mgomo ambao bado unaendelea na kwengineko umesitishwa kufikia ama kutokana na hatua ya mahakama. Hebu tusikize moja kwa moja mahojiano kati ya mwanahabari wetu Ivan Sasiba pamoja na bwana Seth Panyako.
One person. When she arrives, we will begin the signing process. We are actually signing the CBA between the union and Tenwek Mission Hospital. That's what has brought us here today. As I show that we are dealing with honest governments and employers, honestly, not this wakora. Tunasign na hao kesho wanaruka. Tutanyoroshana na hao kabisa. No, you have not said. We have not started. What do you want me to say? All right, the purpose of this today here, we are actually gathered here today to sign the collective bargaining agreement between Kenya National Union of Nurses and Tenwek Mission Hospital. This collective bargaining agreement shall be in force for a period of 4 financial years, and we are very much happy that we have engaged the Tenwek Mission Hospital with utmost goodwill. They have not played the game of seek and hide as is being played by the 2 levels of government, and I hope as they continue to pray, they should pray for this country so that we have honest leaders who can keep to what they say. I also want to urge the national government to start thinking about repositioning their policy on healthcare delivery. Mission hospitals offer a lot of healthcare services to our people, but they struggle to offer those services. As a union, we are asking the government to begin budgeting and sending some money to mission hospitals so that they can be able to offer quality healthcare services. That is when we'll talk of private-public partnership. We want to urge the government to continue supporting Mission Hospital, but now they must up the game. Now in the budgeting system, they should budget to finance and support mission hospitals in Kenya. So today that's the ceremony we have here today. Thereafter, maybe we shall address you outside these premises on other issues, because these are premises of Federation of Kenya Employers, and as an employer we may not say other things when we are at the premise of the employer. That will not be allowed.
Can you tell us more about this CBA and the negotiation? What does it take, and how has it been, and maybe when is the implementation of this CBA expected? Just expound on it.
Actually, most of the things as we have negotiated with the national government, in most cases we normally have agreements where the disputes, then we sign with the management and workers go back to work. So basically, this CBA came in force. It's already in force from last year, from July 2018. From July 2018, it came in force. And therefore, this already what our members are enjoying. However, it's being implemented for actually a period of 4 years, counting from last year. If we count from today, it will be 3 years. But from last year, it's a period of 3 years. So I will not go into much of the details, but what I want to say is that this CPA thrusts Tenwek Mission Hospital as the best mission employer in Kenya. It even beats now Kijap. Now Tenwek becomes the best place for any nurse to work in Kenya if you want to work in the mission hospital. Their terms that we have negotiated are molded along what their colleagues get in public hospitals. Though it may not be the same, because as I've told you, Tenwek has to generate money to pay the workers. There is no budget for Tenwek the way as in the public sector we have a budget. So when we negotiate, we must look at all the factors, including affordability, sustainability, and those are the factors we look at. And we also look at comparison, the differential wage between the nurses and other workers within the same job group. But what I'm saying is that the document we have is one of the best in terms of mission hospitals. In fact, the best has been Kijape Mission Hospital. But now Tenwek has beaten Kijape Mission Hospital. Now we will be focusing on Kijape now to up the game so that they catch up with the Tenwek Mission Hospital. Now the only responsibility will be left as a union is now to work hand in hand with Tenwek Mission Hospital to ensure their quality healthcare services are offering to continue and to improve on what they are already giving. We will also be engaging the government, as I've told you, that now it is time for government to start allocating some money to mission hospitals because they serve Kenyans. And every Kenyan who seeks medical attention in a mission hospital, which is like a public hospital, should access without a lot of pain. That's why we want the government to subsidize services offered by mission hospitals in Kenya. The details, you will have the details once we have completed signing. We'll do photocopy and we'll give you, and you will analyze for yourself and report what you wish to report. But I can promise you, this will be the best CPA in mission hospitals. Thank you.
But when you talk about the best mission hospitals in the country, what is it you are talking about away from CPA? Is it the best services?
First of all, you know that Tenwek is one of the premier institutions in terms of private mission hospitals in terms of service delivery. I know there are 3 hospitals that have been fighting to be the top. I know there is Maua Methodist Hospital, I know there is Kijape Mission Hospital, and I know there is Tenwek. But all of you are Kenyans, and you know what Tenwek has done. It has done some of exemplary surgeries. It has done some of exemplary procedures. But we are saying, when you make your workers happy, you are now preparing yourself to be at the top. Those mission hospitals who are still fearing the union and think that the union is there to fight them must learn from Tenwek. Now our responsibility is, and I'm telling my members in Tenwek, our responsibility is to make sure Tenwek becomes the best hospital in Kenya. Once we have agreed with the management, what is left? What is left for us now is to work. There will be nothing that will make us fight, because I've already told you, in fact, it's already being implemented. So there is no fighting on implementation. It's already being implemented. So our members, what is left for our members is to ensure that we give back to Tenwek. It has given us, and we must give it back. Because even the Bible says, to whom much is given, much is expected. So what has been given to us, in comparison with the mission hospital, Tenwek has given us the best. But we are still struggling next to CPA to improve on that, what we have. But for now, for a period of 4 years, I can tell you, the only thing we shall be doing, I'll be going to Tenwek to visit the CEO, and he gives me mursik, and I drink, and I go back to Nairobi. I will not be going for any strike, because there will be no strike. That's all I can say, unless the CEO will wish to say something.